Hello, my name is Krista Simpson, and I'm going to speak to you a little about schizophrenia today. I'm going to discuss the definition, the prevalence, the classification, causal factors, prevention, assessment, interventions, and educational implications, as well as some supports we can offer. The DSM-5 definition. DSM stands for Diagnostic and Statistical Manual of Mental Disorder. The definition states that schizophrenia is a severe chronic mental disorder characterized by disturbances in thought, perception, and behavior. It includes a range of problems with cognition as well as behavioral and emotional ramifications. It is a chronic condition that requires lifelong treatment and support. It's basically an illness that affects how a person thinks, feels, and behaves. An example of this would be that they no longer think or act logically. They may no longer seem to react the way they should in certain situations. They may not seem to care about anything anymore. They may behave in ways that's just not typical for them. Prevalence. 0.3% to 0.7% lifelong prevalence with psychotic symptoms emerging from the mid-teens to the mid-20s. Symptoms occur more often in men in their early to mid-20s, while symptoms appear in the late 20s for women. Childhood schizophrenia is rare, but is still considered a severe mental disorder. Classification. DSM-5 Criterion A, which include the 5 key symptoms of psychotic disorders. They include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. There must be 2 or more symptoms present for an extended period of time to be classified as schizophrenia, and one of the 2 must be one of the top 3: delusions, hallucinations, or disorganized speech. Delusions are basically a strong belief that something is real when it's not actually based in reality. Hallucinations are seeing, hearing, tasting, feeling things that aren't actually there. Disorganized speech is a thought disorder which interrupts verbal communication. Disorganized or catatonic behavior. It is like jerky movements and restlessness, a state of stupor or immobility, a lack of ability to communicate. Negative symptoms are symptoms that prevent productivity, maybe a loss of interest or a loss of emotion. The person may not want to work anymore. It actually just diminishes one's abilities. There are 2 types of symptoms: positive symptoms and negative symptoms. Positive symptoms add to the person's behavior, such as delusions, hallucinations, and disorganized speech. It is something new that you can pinpoint. Negative symptoms take away. That's when they introvert, lock themselves away, either inside of their head or inside of their home. Causal factors. The causes of schizophrenia in children is unknown, but is believed to develop in much the same way as adult schizophrenia. Doctors attribute it to a combination of genetics, brain chemistry, and environmental factors. The naturally occurring neurotransmitters, dopamine and glutamate, may be contributors to the onset of this disorder. Risk factors. Family history of schizophrenia, increased immune activation, inflammation or autoimmune disease, older age of the father, pregnancy or birth complications such as malnutrition, toxin exposure, or viruses that impact brain development while the baby is still in utero. It could also be the use of mind-altering drugs in the teen years or even in adulthood. Prevention. There is no preventative treatment for this disorder. However, Early identification and treatment are believed to minimize psychotic episodes, which can be terrifying for both children as well as adults. Assessment. There are no lab tests that diagnose schizophrenia, but a doctor will perform a series of diagnostic tests, including a complete medical history, psychiatric assessment, MRI or CT scans, and blood tests to rule out any kind of physical illness that may be causing the behavior. There are actually 3 stages to schizophrenia: the prodromal phase, the active phase, and the residual phase. The prodromal phase is the first stage, is the earliest stage. And while the person's in the prodromal phase, you don't actually, they don't, as well as you don't, realize that they're actually in the first stages of a psychotic break. The active stage is the stage where they start having delusions and hallucinations, and they're actually in psychosis. The third phase is the residual phase. That's after the psychosis has died down and they're going back to normal, but it's like a resting phase, because schizophrenia is a lifelong chronic illness. Interventions. Treatment for schizophrenia include counseling and medication. The goal of the treatment is to lessen the symptoms so that the person can resume a normal lifestyle. Educational implications. Schizophrenia negatively impacts education as well as employment. In adults, it creates social and occupational dysfunction. In children and adolescents, they fail to reach their expected level of interpersonal, academic, or occupational achievements. If left untreated, it can result in severe emotional, behavioral, and health-related problems. Complications associated with schizophrenia may occur in childhood or later in life, and they can include suicidal ideations, which means they contemplate suicide, being victimized, self-injury, which basically means they could just be cutters, or they could, when they have hallucinations and delusions, they may believe that there's something inside their skin and they want to cut it out. Family conflicts, anxiety, panic disorder, and OCD, an inability to attend school or work, depression, social isolation, health and medical problems, legal and financial problems, and even homelessness. Abuse of tobacco, alcohol, or drugs. And last of all is uncommon behavior. It's an aggressive behavior. So how can we support people who have schizophrenia? We can help them to schedule regular doctor appointments. We can remind them to take their medications. We can help them to avoid alcohol and illicit drugs. A lot of the time, people with schizophrenia are looking for an out or a release, and they turn to drugs or alcohol. And one of the main things you can do is to be a support system for them so that they don't have to turn to drugs or alcohol. You can help them to de-stress. One way to do that would be to take them to do something that they enjoy doing, like going to a park or going for a walk. You can also help them to maintain a healthy weight. And again, you could take them for daily exercise instead of letting them lock themselves away like they tend to do. You can avoid power struggles. You can help them to maintain social skills. We can support them emotionally. It's important to remember that they need treatment, and the best thing we can do is encourage them to get treatment and to stay in treatment. We can always remember that their hallucinations and delusions seem very real to them. Arguing with them and trying to convince them otherwise doesn't help. You just have to support them any way you can. You have to acknowledge the right that they can see things the way they want to, because their brain tells them that what they're experiencing is real. And trying to discredit that and make them see what is actual reality doesn't work for them. You can help them to maintain their social skills. It's very common for them to lock themselves away and try to stay away from people, because a lot of time with paranoid schizophrenia, they feel like somebody is after them. And if you help them to stay in the social environment, there's a better chance of their recovery. We must also support them emotionally, and we must also be prepared to intervene. The intervention would come in the form of, if they were contemplating suicide or self-harm. You could also try to help them join a support group or join with them. Thank you.